I mean, I'm wondering whether we could focus on how we pay for expanding healthcare.
Yes.
Healthcare coverage, and whether we would pay for it strictly with, and only with, healthcare savings.
Okay, let me respond to, what was the first one? You asked a long second question. What was the first
Accounting.
one? No, the accounting and the true-up. What was the first? Oh, the healthcare taxing benefits. In theory, you're right about taxing benefits because employer-based healthcare is bad for our economy. Now, most people like employer-based healthcare, and I think Obama is absolutely right not to push people out of it. But in fact, Canada actually has, their businesses now have a competitive disadvantage to our businesses because even though they pay more taxes, their taxes haven't been going up at 2 times the rate of inflation, 2.5 times the rate of inflation, and our health insurance premiums for General Electric and General Motors and so forth have. So if your goal is to push people out of employer-based health insurance, taxing the benefits is a good idea. I don't think that's a good idea immediately. Maybe someday down the road people want to talk about this debate again, but right now, until the systems are in place to handle everybody in America in a public option, I really don't think it's a good idea to push people unnecessarily. I think this choice really does have to be left to the American people. So that I would worry about, even though it's a good idea in theory. But it's one of those things in practice that if you do it, you're apt to cause enough problems so that you're not going to have much health care reform. On the Medicare stuff, there was a brilliant article, I think was in the New York Times this past week, or it could have been in the Wall Street Journal, although I kind of doubt it was on the last 2 pages. And that is to begin the process of truing up. The biggest problem, there are a lot of problems with Medicare, but one of the big problems is that, there actually is no trust fund because we've borrowed it. We ought to pay that back, and we ought to be paying it back $100 billion a year for the foreseeable future.
It's underfunded by $66 trillion.
Yeah, it is, but we ought to at least begin the process of doing that. And the $66 trillion is an actuarial number, in fairness. I mean, so there's a lot of assumptions that are in there that they're going to be changed because you can't just print money and put it in there. So let me just say one other thing. When I wrote this book, I promised myself that I would not attack congressman or the president of either Congress party on issues other than saying something that's flat out not true, on issues that had to do with funding and other things, that the only thing that I cared about was the public option. The reason I took that position is Congress is a hard job, and these guys or gals every day have to vote on something that's going to make somebody mad and make somebody else happy, and that's what they do. It's easy for me to stand outside the arena and criticize everything they do if I don't have to vote. So I tried to pick the one thing that I thought was absolutely essential in this bill, in Obama's bill, which is the public option, and focus on that. I did slip a little in the book. I made 2 suggestions, which I made really clear in the book that I wouldn't push in the bill, and I'm not pushing them in the bill. But one of them had to do with finance, and that is to use a carbon tax to finance all this. It makes sense. It's a regressive tax, but the people at the bottom are the people who are going to get their biggest benefit from the fact that they're now going to be able to have health insurance that nobody can take away from them. It's great for the environment, and it uses fiscal incentives to change people's environmental behavior, and it's a huge untapped resource relative to where the Europeans are. That's how I would fund it. But again, I'm not pushing that. I think we'll revisit the funding many times, and as Winston Churchill said about the Americans in general and the American Congress in specific, you can always count on them to do the right thing after every other possibility is exhausted. I get 3 more, I'm told, so everybody who's beyond the next 3 is going to have to sit down. You don't have to sit down, but you're not going to be heard.
Can any health care reform be successful without enormously increasing the number of primary care physicians? And does the president's plan do that, or what do you think does it, and how is it done? And I base that question not only on reading about the shortage, but some months ago I had to find a new primary care physician. I have a great health insurance plan. I live in the D.C. area. I called 25 primary care physicians. 12 of them are now specialists. They don't take primary. Of the other 12, 10 of them were taking no new patients at all. And out of the remaining 2, they could see me in 2 months unless I had a very high fever. So we're about to create a plan one way or another that's going to dump some tens of millions of more people into the healthcare system, which seems incapable of dealing today with people who have insurance. What do we do about that?
There are some things in the bill that are not adequate, but they're getting better. One of the things that the Blue Dogs did to the bill, which, and I know the Blue Dogs are not held in high regard by some of the members of my end of the party, but they have contributed a couple of great things. One is they made it much better for small businesses. If you have a payroll under $500,000, you don't have to deal with health insurance at all anymore, and that's a huge boost to the people who create 80% of all new jobs. Another one is the issue that you have raised. They said that Medicare rates may not be used for the public option. They didn't get rid of the public option, but they said you cannot pay Medicare rates. That's a big plus. Because one of the reasons that you can't get primary care doctors is because they get paid less than they do in Britain. And one of the reasons they get paid less than they do in Britain is because Medicare compensation for primary care is atrocious. And the way that insurance companies have saved money as they try to push down the cost for or push up their profit is to pay Medicare rates. Now, if you want to fix primary care, you've got to do a couple things, and the bill does some of them and not all. First of all, you've got to raise compensation for primary care providers. Second of all, you have to allow nurse practitioners to be recognized for what they are. 60% of most of what I did as an internist could have been done by a competent, well-trained nurse practitioner. Thirdly, and this is something Bush gets some credit for, is one of the few things I agree with him on. He put a lot of money into federally funded, federally qualified funded health centers on the idea that that was going to be a place where a lot of people could get health care. And they're very good. We've got a bunch of them in Vermont. And they started out as poor people's clinics, and now they're really a clinic that anybody can go to and have to have their own medical home. And fourthly, if you want to sign up for the public option, you've got to have a medical home. That's very, very important. A lot of these folks do have doctors, these poor people and the people who don't have insurance. But they're doctors who rotate all the time through the emergency rooms or however they get them, and of course they don't usually go until it's very, very late in the process. If everybody's required to have a medical home, that is something the free market will do. The free market will increase the amount that you're able to get paid for. The other, you're able to pay primary care people, not just physicians. Finally, 9% of all medical graduates in 2007 ended up in primary care. 9%. The average medical person who graduates from medical school is something between $100,000 and $100,000, $150,000 in debt. One of the things that has been toyed with in the bill, and I think it's in one of the 4 versions of circular that's been passed, is that if you're going to enter a primary care specialty and make a commitment to that for a significant amount of time, that you graduate from medical school debt-free so you can afford primary care so you don't have to pay your debts back. So all those things, your point is exactly well taken. There's some stuff in the bill, but not everything.